Hi, everyone. Thank you for joining today's Web Interface webinar for groups, virtual groups, and APM entities. CMS is hosting 2 transition webinars for groups, virtual groups, and APM entities, including Shared Savings Program ACOs, that have been reporting data for the quality performance category through the CMS Web Interface and will transition to using a different submission mechanism for future years of the Merit-Based Incentive Payment System, or MIPS. During this webinar, CMS will provide information regarding other available options under MIPS to report data for the quality performance category. This presentation will be followed by a Q&A session where attendees will have an opportunity to ask questions via phone in the Q&A box, and CMS subject matter experts will address as many questions as time allows. You are welcome to submit questions during the presentation or wait to submit your questions until the Q&A portion of the webinar. Now I will turn it over to Lisa Marie Gomez at CMS to begin.
Welcome everyone, and thank you for joining us today. As groups and virtual groups and APM entities prepare to transition from reporting via the CMS Web Interface to using another collection and submission type, we want to provide information and steps for you to consider as you decide which collection type or submission type your group, virtual group, or APM entity will transition to. Today is the first of 2 CMS Web Interface transition webinars. The next webinar will be held on Wednesday, February 16th, 2022. Next slide, please. This is a disclaimer slide regarding this presentation. Information in this presentation is current at the time of publication. Next slide, please. During today's presentation, we will provide background information, outline the purpose of the presentation, discuss the alternative reporting options under traditional MIPS, highlight key elements to consider and next steps, and provide additional resources. After this presentation, as Emily noted, we will have a question and answer session. Next slide, please. Now we will begin with background information. Next slide, please. In the calendar year 2022 physician fee schedule, we finalized policies to sunset the CMS Web Interface. For groups, virtual groups, and APM entities reporting traditional MIPS, the 2022 performance period will be the last performance period the CMS Web Interface will be available. Starting with the 2023 performance period, an alternative collection and/or submission type will need to be used to report quality measure data. For the Medicare Shared Savings Program, the CMS Web Interface will be available through the 2024 performance period. Next slide, please. Now I will briefly outline the purpose and objective of this presentation. Next slide, please. As groups and virtual groups prepare for the sunsetting of the CMS Web Interface, we want you to become familiar with the MIPS quality performance category reporting requirements that differ from the CMS Web Interface reporting requirements. We want you to also gain an understanding of the various alternative options for quality data collection and submission under traditional MIPS, and we want you to also become familiar and to consider key elements and timelines as you transition to using an alternative option. Next slide, please. For the next few slides, I will discuss the reporting requirements and then provide an overview of the alternative reporting options for the quality performance category under traditional MIPS. Next slide, please. For the 2023 performance period, the following outlines the general quality performance category requirements for alternative options. You'll be required to select and report quality data for at least 6 measures, including 1 outcome measure. If there isn't an applicable outcome measure, then report on a high priority measure. In regard to the data completeness, you will report aggregated performance data for at least 70% of denominator eligible encounters across all payers that are eligible for each measure selected. In order for a measure to be scored, a measure would need to have a minimum of 20 denominator eligible encounters for the measure. Next slide, please. The information on this slide provides a comparison between the CMS Web Interface requirements and alternative option requirements to illustrate some of the differences between these experiences. For example, under the CMS Web Interface, you register to use the CMS Web Interface and are required to report quality data for all 10 predetermined measures, whereas under alternative option reporting options, There is not a registration requirement, and you get to select a minimum of 6 measures to report. Next slide, please. As a continuation of the information from the previous slide, this slide outlines additional differences between the CMS Web Interface requirements and alternative option requirements. For example, the data completeness criteria under the CMS Web Interface requires the reporting of patient-level data for the first 248 consecutively ranked Medicare patients identified from a sample for each measure, whereas the data completeness criteria for the alternative reporting options requires reporting of aggregated performance data for at least 70% of denominator-eligible encounters across all payers that are eligible for each measure selected. Next slide, please. Now I'm going to provide an overview of the alternative reporting options. Next slide, please. So the alternative reporting options refers to the data collection and submission types for quality measures. For the next few slides, I will be discussing collection types. A collection type refers to the way in which data is collected for a quality measure. Data for one measure may be collected in multiple ways. Each collection type has its own specific instructions for how to report that measure, which is through their measure specifications. And it also outlines, how to meet the data completeness or case minimum requirements. To become familiar with the various collection types and quality measures associated with the collections in advance of the 2023 performance period, we encourage you to review the 2022 measure specifications. Next slide, please. The information on this slide provides general information pertaining to the ECQM and MIPS-CQM collection types and provides links to the 2022 measure specifications. Just want to note that there is an ECQM equivalent for all 10 CMS Web Interface measures and a MIPS-CQM equivalent for 9 of the 10 CMS Web Interface measures. Next slide, please. The information on this slide outlines general information pertaining to qualified clinical data registry measures, also known as QCDR measures, and the CAPS-RMIS survey measure, collection types, and provides links to the 2022 measure specifications and other resources. Please note that the quality measures available for the 2023 performance period will be established through future rulemaking, with the exception of QCDR measures. Next slide, please. Now I'm going to discuss the submission of data using third-party intermediaries. In addition to selecting quality measures and collecting data for each measure, you will need to consider if you will submit your own data or work with a third-party intermediary to submit data on your behalf. QCDRs and qualified data registries are vetted and approved by CMS to support data collection and submission of quality measures, promoting interoperability measures and improvement activities on behalf of a group or virtual group. QCDRs and qualified registries are required to support all MIPS performance categories that are required data submission, with some exceptions for promoting interoperability performance category. QCDRs and qualified registries provide performance feedback at least 4 times per year. The feedback can help drive practice improvement and alert groups and virtual groups of the changes needed in workflows or processes to improve performance prior to submission. We publish a list of approved organizations with contract information, services offered, pricing, and the specific quality measure and or QCDR measures they support prior to the start of the performance period. Next slide, please. In general, the population of approved QCDRs and qualified registries is fairly consistent from year to year. We encourage you to review the 2022 qualified briefings to get a sense of the costs and services offered by these organizations. If you do not want to use a QCDR or qualified registry, you can choose to work with a health information technology vendor. Please note that there is not a vetting or approval process specific to MIPS for health IT vendors that aren't QCDRs or qualified registries, but you can search the Certified Health IT product list for vendors that offer CERT products. Next slide, please. If you want to submit data yourself, the process to submit an ECQM and or MIPS-CQM is similar to the process you experience under the CMS Web Interface. When submitting data yourself, you may experience challenges in being able to properly format your submission according to the file specifications. The next few slides will provide screenshots of the current data submission user experience, which pertains to the 2021 performance period. Please note that the user experience for future submission periods may vary. Next slide, please. So to submit data yourself for an ECQM or MIPS CQM, the user experience will be similar with a few exceptions to your experience with the CMS Web Interface. So first, you will sign into your account through the QPP website, and then you'll find your practice or virtual group. Next slide, please. Then you will select to report as a group or report as a virtual group. And then after this step, the user experience will be different from the CMS Web Interface user experience. Next slide, please. To submit an ECQM and or MIPS CQM, you will upload a file. Once you upload your file, the performance category scoring is available. Next slide, please. The information on this slide pertains to ECQMs. So to collect and submit your own data for ECQM, your certified EHR technology or CERT will need to be configured to collect data according to the ECQM specifications for the 2023 performance period before the performance period begins. Performance data is captured in your group or virtual group's 2015 edition CERT, including CURE's update criteria throughout the performance period. You will run and export a report of aggregated measured data from your group or virtual group CERT. If you are using multiple CERT systems, data must be aggregated into a single file before you can submit it. Then you will upload the report, which is a quality reporting document architecture category 3 or QRDA3 file to the QPP website. If you're working with a third-party intermediary, your group or virtual group CERT must be configured to collect data according to the ECQM specifications for the 2023 performance period before the performance period begins. Performance data is captured in your group or virtual group's 2015 CERT, including CURE's update criteria, throughout the performance period. The third-party intermediary you select will submit your data to CMS via the file uploaded or QPP submission API. Next slide, please. The information on this slide pertains to MIPS CQMs. To collect and submit your own data for MIPS CQMs, your performance data will be captured in your group or virtual group's medical record, EHR, or paper chart, and or other data sources throughout the performance period. To extract data from an EHR, your group or virtual group's EHR must be configured to collect data according to the MIPS CQM specifications for the 2023 performance period before the performance period begins. If you are collecting measured data in an EHR, run and export a report of aggregated data from your group or virtual group's EHR. If you use multiple EHR systems, all denominator eligible encounters and performance data for each quality measure must be aggregated into a single file for the submission. Data must be formatted according to the QPP JavaScript object notion file specifications. You will then upload the file to the QPP website. If you are working with a third-party intermediary, your performance data will be captured in your group or virtual group's EHR and are specified by your group or virtual group's selected qualified registry, QCDR, or other health IT vendor throughout the performance period. Your selected third-party intermediary will submit your group or virtual group's data to CMS via file uploaded or QPP submission API. Next slide, please. The information on this slide pertains to QCDR measures. So when working with your selected third-party intermediary, your performance data will be captured in your group or virtual group's medical record, EHR, or paper chart and or other data sources as specified for your group or virtual group selected QCDR throughout the performance period. The selected QCDR will submit your data to CMS via file upload or QPP submission API. Next slide, please. For the next few slides, I'm going to review scoring policies. Next slide, please. This slide outlines benchmark policies with a comparison between the CMS Web Interface and alternative collection types. I will only discuss the benchmark policies pertaining to the alternative collection types right now. So historical benchmarks are developed based on data submitted by CMS or submitted by MIPS submitted to MIPS by individual MIPS eligible clinicians, groups, virtual groups, and APM entities 2 years prior to the performance period. Benchmarks are specific to collection type. The same measure will have different benchmarks if it can be reported through multiple collection types. If there is not a historical benchmark, a performance period benchmark would be calculated when 20 or more individuals, groups, virtual groups, and/or APM entities report the measure through the same collection type. Next slide, please. This slide outlines measure achievement points with a comparison between the CMS Web Interface and alternative collection types. But I'm only going to discuss things relative to the alternative collection types. So a group and virtual group would receive the following achievement points. Between 1 and 10 achievement points based on performance if the measure meets case minimum and data completeness criteria and can be scored against a benchmark. There is an exception for new measures in their first 2 years in the program. You can also receive 0 to 10 points for required measures that aren't reported, or 0 out of 10 points for measures that don't meet the data completeness requirements, or 0 out of 10 achievement points for measures that don't meet the case minimum requirements. Fewer than 20 denominator eligible encounters reported, and there is an exception for new measures in their first 2 years in the program. You can also achieve 0 out of 10 achievement points for measures that can't be scored against a benchmark, and again, an exception for new measures in their first 2 years in the program. Next slide, please. This slide outlines maximum achievement points available with a comparison between the CMS Web Interface and alternative collection types. Please note that there are not end-to-end electronic reporting bonus points or high priority outcome measure bonus points. For the alternative collection types, the following are the maximum achievement points available. So 60 points for 6 submitted measures, which can include a CAPS or MIPS survey measure, 70 points for 6 submitted measures plus 1 administrative claims measure, 80 points for 6 submitted measures plus 2 administrative claims measures, 90 points for 6 submitted measures plus 3 administrative claim measures. Next slide, please. Now I'm going to discuss the next steps that you'll want to take, which will include key elements to consider and timelines to also consider. Next slide, please. The first step is to determine your collection type in which you will want to start planning right now. The key elements to consider for this step includes the following. Does your group or virtual group have the 2015 edition or 2015 edition Cures Update cert? This is required to report ECQMs. If your group or virtual group's EHR or Health IT model is listed on the Certified Health IT product list, it has been certified through the Office of National Coordinator for Health Information Technology, also known as ONC, their Health IT certification program. There will be an indicator alerting your virtual group or group to the certification edition. Recognize that ONC certification can be a lengthy process, but you can still report ECQMs for the 2023 period if the following 2 criteria are met. Your systems have 2015 edition or 2015 edition Cures Update, or a combination of both, cert functionality in place at the start of the 2023 performance period. Your system obtains ONC certification, so the 2015 edition or 2015 edition Cures Update, or a combination of both by December 31st, 2023. You'll also need to consider reporting MIPS ECQMs and or QCR measures if your group or virtual group's EHR isn't certified or isn't on track to the 2015 edition certification according to the timeline, which is, everything has to be done prior to the performance period starting. Next slide, please. The second step is to determine if you will work with a third-party intermediary, in which you will want to start planning now. The key elements to consider in this step include the following. Does your group or virtual group have multiple EHRs or multiple data sources, EHR, paper chart, or other data sources that you collect information from? All denominator eligible encounters and performance data for each quality measure must be aggregated into a single file for submission. Another element to consider is, does your group or virtual group have an IT department to support measure coding and data extraction? For the third step, you'll select your measures. You will want to start planning for your measure selection during this year, which is now. The key elements to consider for measure selection are the following. Do you want to continue reporting the primary care measures that are available for the reporting of the CMS Web Interface through another collection type? Or are there other quality measures that capture metrics your group or virtual group would like to improve? Please note that the quality measures available for the 2023 performance period will be finalized in the calendar year 2023 physician fee schedule final rule, which will be published in November of 2022. But you can start preparing by reviewing the 2022 MIPS CQM specifications, reviewing the 2023 ECQM specifications that will be available in May of 2022, and reviewing the calendar year 2023 PFS proposed rule, which will be published in the summer of 2022. Proposals relating to the addition or removal of measures, as well as changes to the specifications. You'll also want to review HCPCS, CPT, and ICD-10 codes that you commonly bill. This will help you identify denominator-eligible encounters for available measures. Also, you'll want to ensure that the measures you select are offered within your chosen collection type. If not, you may want to consider a different collection type or different measures. Next slide, please. Step 4. You will choose a third-party intermediary if you want a vendor to submit data on your behalf. You will start your selection of a third-party intermediary in 2022. The key elements to consider include the following. Will the third-party intermediary work well within your current systems? Does the third-party intermediary report the same measures you've selected? You can start preparing now by reviewing the 2022 QCDR and qualified registry qualified postings. Start by searching for third-party intermediaries that support groups or virtual groups participation. Then refine that list by searching for those that support your group or virtual group selected quality measures. Finally, you can narrow down the option by cost, services offered, and other criteria that are important to your group or virtual group. Next slide, please. For step 5, you will update your systems as applicable. If you plan to report an ECQM, you will begin to update your systems in June of 2022. If you plan to report MIPS CQMs, you will begin to update your systems beginning in December of 2022. Key elements to consider for ECQM reporting include the following. Review the ECQM implementation checklist on the Electronic Clinical Quality Improvement, or ECQI, Reporting Resource Center. Connect with your EHR vendor as needed about coding updates they may provide for 2023 ECQMs. And the key elements to consider for MIPS CQM reporting include the following. Update your systems to be available to capture the denominator-eligible encounters identified for HCPCS, CPT, and ICD-10 coding for measures you've selected. And connect with your EHR vendor as needed about coding updates that may be provided for the 2023 MIPS CQMs. If you're not able to get your systems updated to start collecting data starting on January 1st, 2023, look for third-party intermediaries that can help your group or virtual group retroactively identify and capture all denominator-eligible encounters in order for your group or virtual group to have complete reporting. Next slide, please. The next several slides provide a summary of the various steps, as I mentioned, that you will need to take and very, very specific timelines. So for step 1, you will need to determine the certification status of your group or virtual group's EHR systems. You'll start the certification process now if your group or virtual group intends to report ECQMs for the 2023 performance period. This process can take 12 to 18 months. Next slide, please. So between now and December of 2022, you will need to determine your collection type, determine whether you need or want to work with a third-party intermediary. You'll need to become familiar with the existing quality measures and quality measures that are proposed for removal, updated, or addition for the 2023 performance period. And for this, you'll want to see the 2023 PFS proposed rule, which will be published in the summer of 2022. You'll also want to review the list of 2023 quality measures and updated specifications, which will be available in December of 2022, which is following the publication, which will be published in calendar year. Which will be published following the calendar year 2023 PFS final rule. You'll also want to review the ECQMs and their specifications, which will be available in May of 2022, but won't be finalized for inclusion in MIPS until the calendar year 2023 PFS final rule, which is released in November of 2022. You'll want to review the QCDRs and qualified registries currently approved for the 2022 performance period to become familiar with the services offered. Qualified postings identifying the QCDRs and qualified registries approved for 2023 will be available in December of 2022. Next slide, please. Between June and December of 2022, you will do the following if you are planning for ECQM reporting. Update your systems to identify and track denominator eligible encounters for your selected ECQMs according to their 2023 specifications. Review ECQMs and their 2023 specifications that will be available in May of 2022, but won't be finalized for inclusion in MIPS until in the calendar year 2023 PFS final rule, which is released in November of 2022. In December of 2022, you will need to do the following. Confirm your quality measures for the 2023 performance period. Choose a third-party intermediary if applicable, and update your systems to identify and track denominator eligible encounters for your selected ECQMs according to their 2023 specifications. Next slide, please. The timeline on this slide outlines timeframes pertaining to the 2023 performance period. So in January of 2023, you will start capturing performance data for the 2023 performance period. Between April and June of 2023, you will register for the Capture MIPS survey measure if you plan to administer that for the 2023 performance period. And between January and March of 2024, you will submit MIPS CQM or ECQM QCDR measures data for the 2023 performance period. Next slide, please. The next few slides will outline available resources. Next slide, please. If you need assistance, please refer to the contact information listed on this slide, and you should be familiar with this information. Thank you. Next slide, please. The following two resources provide additional information regarding the transition to reporting MIPS CQMs and ECQMs. These resources will be available next week, and we will distribute the links to these resources via the CMS Web Interface listserv. Now I'm going to turn the presentation over to Emily Schutz to begin the question and answer session.
Thanks, Lisa Marie. We're now going to begin the Q&A portion of the webinar. You can ask questions via the Q&A box or through the webinar audio. To ask a question through the webinar audio, please raise your hand and we will unmute your line so that you can speak. To submit a question anonymously through the Q&A box, please click Send Anonymously. Otherwise, all attendees will be able to view your question. We'll begin with taking questions from the phone line. And it looks like Marcella Chanes, you have your hand raised. So I'm going to go ahead and unmute your line so that you can ask your question. And you will also have to unmute yourself on your end as well to speak.
Hey, this is Marcella. Thank you so much. No, I had not realized the chat that y'all were posting this in the library in 2 weeks. And I was wondering, so I did see that y'all are going to post it. That was really my question. And are y'all going to share also the video or the recording or just the slides?
Yes, we will be sharing a recording of the webinar as well as a transcript along with the slides.
Thank you.
Okay, and up next, Jennifer Gasparini. Looks like your hand is raised, so I will go ahead and unmute your line.
Thanks. Jennifer Gasparini with the National Association of ACOs. I noticed that you hadn't really discussed in detail here some of the nuances for ACOs specifically. You know, just off the top of my head, the scoring rules and some other nuances here about how these requirements pertain to ACOs. Can you talk a little bit more about that? I think it would be helpful for your audience.
Well, for today's presentation, we were focusing on groups and virtual groups because the transition to the to another collection type starts with the 2023 performance period, whereas ACOs have an extended time frame for the up until 2025. So we did not go into the details relative to that. I know there are folks that we have from our Shared Savings Program. So if they can elaborate on those particular elements in terms of how it differs in terms of if you're, reporting as an ACO using other collection types, how that will work. So I will turn it over to Sandra or anyone from RTI.
Thanks, Lisa Marie. This is Sandra, and Jennifer, thanks for your question. We do have a 2021 APM Performance Pathway Toolkit that is posted on the QPP resource library. It includes several resources to help ACOs report quality data, including an APM Performance Pathway reporting scenarios document within that zip file. We've also had a few webinars about the APM performance pathway specifically for ACOs that you may find helpful. But because the CMS Web Interface is available to ACOs this year, these transition webinars are primarily focused for the groups and virtual groups that will not have that available to them next year.
Yeah, it's just helpful to put that somewhere on these slides so that if an ACO is tuning in or a group in an ACO is tuning in, they know that there's a different timeline, different scoring rules, and different requirements for ACOs. So just a suggestion to reduce confusion for the ACO practices. Thanks.
Yeah, thank you, Jennifer. That's a helpful comment.
Great. Well, it looks like those are the only questions or only folks with their hands currently raised to ask a question, but please raise your hand if you would like to ask a question through the phone line. So now I believe we can move into some questions that were submitted via the Q&A box. And so the first question that we have here is, can groups not participating in the MSSP program still able to use the CMS Web Interface for performance year 2022?
So for 2022, the web interface will be available. So as I was noting, that there is a difference in terms of the sunsetting of the CMS Web Interface between groups, virtual groups, and specifically ACOs that are participating in the Shared Savings Program. So for those who are participating in the Shared Savings Program, the last year that you will be able to utilize the CMS Web Interface is the 2024 performance year. And then starting in 2025, you will need to transition to another collection type.
Great, thank you for that response. And along with that, there's another question in the Q&A box that asks, I thought MSSP do not have to register for the CMS Web Interface. Is this correct?
That is correct. ACOs participating in the Medicare Shared Savings Program do not register for the CMS Web Interface. Groups, virtual groups, and other types of APM entities that are not ACOs participating in the Shared Savings Program register for the web interface. But you are correct, ACOs participating in the Shared Savings Program do not.
Great, thanks for that clarification. We have another question that's come in through the Q&A box that asked, for ACOs, there are multiple TINs across different systems. Is there guidance on how ACOs can aggregate its participating TINs? Are we expecting to collect QRDA patient level files and aggregate into QRDA3?
I'm going to defer this. Oh, go ahead, Stephen. Just going to defer to you.
Yeah, so basically the SSP program is currently working through guidance on how to report, whether it be the ECQM methodology or for the MIPS CQM version of the measures, looking to put out basically definitive guidance on how that should work and working with the ECQI team. So that is pending right now. There is no formalized guidance. But once it is finalized, it will be available on the resource library.
Great, thank you. Another question asked, does a qualified registry must be ONC certified in order to aggregate data from multiple certs, QRDA3 files, for submission of ECQMs on behalf of a multi-TIN ACO?
Yeah, so the requirement related to anything that is produced for the purposes of quality reporting from an EHR is that it must have the 2015 certification of the EHR, that the data must originate from there as at least the preliminary step.
Great, thank you. Another question asked, how do we guarantee the 70% completeness rate when patients come and go in commercial insurance and we are expected to report on all patients and all payers?
So the generalized guidance around that for reporting is that all information that is reported is to be true, accurate, and complete, subject to audit. And in the instance that there is an audit, the documentation would be required for you to produce associated with any quality reporting.
Great, and a similar question, someone else asked how CMS determines the 70% rate.
So again, it's across all providers for reporting, and any data that is submitted is subject to audit. So kind of the same answer.
Great, thank you for that clarification. Another question that's come in through the Q&A box asks a clarifying question just to confirm that this year is the last year of the CWI reporting, reporting on 2022. Is that correct?
So for groups and virtual groups that are using the web interface, yes, the 2022 performance period is the last year that the web interface is available. So starting with the 2023 performance period, you will need to start using another collection type. And again, that's for groups and virtual groups.
Great, thank you. Another question that's come in asks, can you clarify that only 6 out of the 10 measures must be submitted, and does this apply to ACOs? So
to report or to meet quality reporting requirements outside of the CMS Web Interface, you're required to submit at least 6 measures. So again, this is outside of the CMS Web Interface. So if you're reporting the quality performance category, that's a requirement. Under the web interface, there were 10 specific measures that you had to report on. So when you're reporting outside of the web interface, you're not required to report on the same web interface measures. There are equivalent ECQM and MIPS CQM measures that are equivalent to the CMS Web Interface, but you're only required to select, if you want to, those measures, 6 of those measures, or any other measures that are available and are quality measure inventory, which is about 200 measures. So you have to at least select 6 measures. Reporting requirements differ for ACOs, but in terms of just general for the quality performance category for groups and virtual groups, it's at least 6 measures when you're trying to report outside of the web interface.
And this is Sandra. Just to add on to Lisa Marie's response, for ACOs, there are a number of resources in the resource library about the APM performance pathway. ACOs are required to report via the APM performance pathway, so the measures are listed within those resources, and so you may find that helpful if you're part of an ACO.
Great, thank you for that information. Our next question comes from the Q&A box as well, and this participant asks, if we wish to report a CQM, do we have to become a certified qualified registry?
Hi, this is Katie from the PIMS team. So when you're reporting CQMs, you yourself do not have to become a qualified registry. There are vendors out there who have been vetted and are already have gone through the selection process of becoming a qualified registry and the QCDR as well. So in that instance, there is a qualified posting each year for those registries, and that's available on the resource library. That posting for 2023 would be available in December of 2022, but you can take a look at the current vendor list now and just sort of get an idea for what types of measures they support. There's also cost-related information on those qualified postings. And then they would assist you in that data collection and reporting. If you have more questions about that process, we would encourage you to submit that to qpp@cms.hhs.gov. Thank you.
Thanks, Katie. The next question that's come in asks if you could clarify the difference between eCQMs and MIPS CQMs.
Yeah, so the difference is generally going to be the origination of the data. So eCQMs have the designation of it must originate from a 2015 cert, as well as it being end-to-end reported with no manual manipulation of the data. The MIPS CQM version can be mined from different sources for reporting. Also, when reporting to QPP, QRDA3 is generally associated with eCQM reporting. And for the MIPS CQM, that's going to be the QPP JSON format.
Great, thank you. And we've gotten some questions about the data completeness requirement. So we are just going to go ahead and expand on that response to cover a couple of the questions that have come in through the Q&A box.
Hi, this is Katie from the PIMS team. So one thing that we did want to try to clarify is that for the web interface reporting, you're reporting on a set of predetermined patients. For other collection types, you're reporting on all denominator eligible instances. So it'd be all patients for all payers who meet the denominator criteria for the measure. So the data completeness requirement is based on the performance data that you submit based on denominator eligibility, rather than that predetermined sample that you're used to seeing. Thank you.
Thanks for that explanation. I'm just going to check and see if there's anyone else who would like to ask a question live on the phone line. Please go ahead and raise your hand if you would like to do so. We do have time to take a couple more live questions. But it doesn't look like anyone has their hand raised right now, so we will go back to our questions that are in the Q&A box. And there was a question that came in that asked, can DCEs use the web interface?
Would you be able to elaborate what DCEs are? Is that a particular APM model?
It does not appear there's more detail within the question, but if that questioner would like to provide some more detail about exactly what a DCE refers to, we are happy to provide that explanation. But I think in the meantime, we can go ahead and move on to another question that's come in through our Q&A box. Oh, it looks like DCE may be a direct contracting entity.
I would have to defer to, I actually don't know if we have anyone from CMMI on our call today, but essentially those who can report through the web interface include APM entities, which also include ACOs that are participating in the Shared Savings Program, groups and virtual groups. So if a direct contracting CMMI model is considered an APM entity, then it is possible for that type of entity to report via the web interface. And again, that would only be available under traditional MIPS through 2022. And then again, for ACOs that are participating in the Shared Savings Program, the web interface is available through the 2024 performance period.
Great, thank you for that. Moving back to our Q&A questions, there's a question in the box that asks, is there any guidance on deduplication of requirements of patient data for the QRDA file type?
Yep, so that's going back to kind of the other questions around how I believe APMs are going to report the QRDA3 file. So again, that information is still pending. There will be definitive guidance that will be released and available on the QPP resource library.
Great, thank you. So another question that has come in asks, in regards to the use of CERT, if the measure specifications include billing data like CPT codes, is that required to be in CERT or the EHR, or can the data come from a non-certified revenue cycle system as long as the clinical numerator data is sourced from CERT or an EHR?
Can you repeat the question?
Definitely. This question asks, in regards to the use of CEHRT, if the measure specifications include billing data, and the example given was CPT codes, is that required to be in CEHRT/EHRs, or can the data come from a non-certified revenue cycle system as long as the clinical or numerator data is sourced from CEHRT or an EHR?
Stephen or Pims are able to address that, or do we need to get back to that question?
Hi, this is Jamie with.
Yeah, it's really kind of relying on the submission pathway of what specifications you're using, and for additional details, you can always check in the final rule or within the measure specifications associated with the measure that you're reporting.
Hi, and this is Jamie. I really think that this would probably be a better team or question for the ECQM team. I believe this is probably in regards to an ECQM rather than a CQM or Medicare Part B claims. And they have their own logic and data sources. The value set is a part of the ECQM, so you would want to refer, maybe send a ServiceNow ticket into that particular team. They'll be able to manage this question probably pretty efficiently. Thanks.
Great, thank you for that response. And we've got another question that's come in from a participant who asked, is it going to be a requirement to use QRDA1 files to deduplicate data and aggregate files if submitting via ECQM? If not submitting CQM, what will be used?
Yeah, so this one, again, the formalized guidance is pending related to how you can report the ECQM versions of these measures at the APM entity level. So once that is published and released, it will be available on the QPP resource library.
Great, thank you. It looks like we've got one more question in our question box. And this participant asks, I understand the data must originate from a CEHRT, but who is allowed to aggregate it if there are multiple EHRs? Can a qualified registry aggregate QRDA files if not ONC certified to submit ACQMs?
I think what I heard is related to ONC certifications. If you're reporting the ECQM version, it would require the 2015 certification related to your cert.
Great, thank you. And there was a clarification question that came in through the chat box that just asked if there's an expected timeline for the APP guidance on aggregation.
It is currently a work in progress. We are trying to get it out to you as soon as possible. I know that with the majority of these questions, most people are kind of probably understanding the complexity associated with how you can actually report that information. So we want to make sure that we're doing our due diligence, and the guidance released would be formalized and also work within the structure of reporting.
Great, thank you so much. And with that, that does conclude our question and answer portion of the webinar. So we will turn it back over to Lisa Marie Gomez to conclude our call.
I want to thank everyone for joining us today, and this is just, the first of 2 webinars that will discuss elements relating to various things to consider as you transition to another collection type. And as I noted earlier, the next transition webinar will be February 16th, same time, which is, Wednesday. So we hope you're able to join us. And if you have other questions that, let's say, that you had today or you weren't able to ask, please join next time and we'll address as many questions as possible. And again, I want to thank you all for joining us and preparing to transition to another collection type. We hope you have a great day. Thank you.